Is it possible for a doctor who never worked in biological implantology just start only with practice without theory?
No, that's not possible. Because during the practice, I mean, when they screw in the implants and when they maybe prepare the flap and prepare the bone, they have to know what they are doing and why they are doing it, and in which sequence they are doing it. And if they have no theory, they typically will end up in disaster. I mean, the patient ends up in disaster.
Okay, some actually doctors do not believe this technology, actually biological implantology, and they say that it's too like new, like it's really it's not proven. How actually it's possible to work with also fixation and not to wait until the integration?
Yeah, well, some implant manufacturers claim that it is necessary to have long-term studies about implants. So they kind of say only we have this, like Straumann and Nobel Biocare. They say, okay, only we have the real long-term studies. The reality is that an implant which has been integrated in the jaw bones for 2 years is successful. It's going to be there also after 10 years or after 20 years, except if peri-implantitis catches this implant. So what is actually needed is a 2-year study. Every implant that's in 2 years must be considered to be successful. So this demand for long-term studies is not supported by people who understand the matter and who understand about the bone and implants. So if something is in 2 years, it will stay there. Problem that the 2-stage implants have is this peri-implantitis. It's a very sad story that after the implant is successful, after it's in 2 years, then peri-implantitis starts. When there are studies from, for example, Derks and Schaller, they showed that peri-implantitis starts in the second, after 2 years or up to 3 years. Then it starts. So when patients start to believe that everything is good, then the problem starts. This is the problem of the 2-stage implants, of these old traditional implants with the experience, like these doctors are saying. The experience and the reality is bad. It's very bad. That's why we don't do these implants. We don't want to use them. I refuse to give to my patients these implants. Very simple.
Okay, other questions. I, as a doctor, can only I, as a surgeon, got into the training? Is it enough, or can I teach myself, my dental technician, and orthopedic doctor?
How to say? I mean, it depends on the country. Like here in Ukraine, typically there are doctors who are surgeons, like me. I mean, I'm a stomatologist, and I have the permission or the license from the government to do surgery and to put the implants. Typically here in Ukraine, the prosthetic doctor is another specialty. So these prosthetic doctors have to learn their part of the job, and actually, when they get the specialty, it's the same like university training. They kind of upgrade their knowledge in the prosthetic work. But again, when it comes to doing prosthetics on the strategic implant, most of the knowledge which they have learned in prosthetic doesn't work anymore. It's not applicable, so they have to learn it new. Now, of course, there are genius people around the world, real genius. They don't need any training. They know everything and they do everything right from the first time. Only I never met such people, but for sure there are such people who don't need any training, or who believe they don't need any training. I think it's advisable for every doctor to take a full training, to be a little bit humble, not to say I know everything. And then, because we work with alive patients and they expect that this works, it's their expectation. They pay us for being successful, so we better get training, Never try to be a hero.